Today we will be discussing a very interesting topic for those females who are suffering from loose, sagging or small breast. Hello friends, I'm Dr. Brajesh Pathak, board certified plastic and cosmetic surgeon. Friends, most of the females, those who had recurrent pregnancies or with the increasing age, or sometimes most of the females, those who are involved in the sudden increase of the weight loss, or in some cases, those females who had already a small breast size from the beginning. These patients mainly suffer from the lack of confidence because she thinks that the breast size is small and she doesn't look very attractive. So the treatment for this problem is known as augmentation mammoplasty, in which the word itself defined, that means we are going to augment the size of the breast. So for the augmentation process, the most commonly done procedure nowadays is the augmentation mammoplasty by silicone implant. So these implants which are used to place inside the breast pocket. So friends, these breast implants are mainly made up of silicone. The gel filled in the implant is the silicone, and the outer layer is also made of the silicone. We will be discussing from where we can place these implants. There are mainly 4 planes in which the surgeon can place the silicone implant inside the breast. As you can see, the first one is the subglandular plane. That means the implant is placed under the glands of the breast. Second plane is subfacial plane. Subfacial plane means the fascia of the pectoralis muscle. The fascia of the pectoralis major muscle is elevated, in which the pocket is created and the implant is placed inside the fascia. Third plane is the submuscular plane, which means the implant is placed inside under the pectoralis major muscle. And now the fourth plane is the dual plane, in which half of the implant is placed under the muscle and half of them on the subglandular plane. So these are the different planes for the breast implantation. It all depends on your surgeon's choice in which he feels comfortable and confident. Nowadays, and most of the surgeons, those who are using, is the subfacial planes. It is the safest, more aesthetic look and less complication rate. So these are the planes in which we have to place the implant. This surgery is basically done under the general anesthesia, and we use the incision in the inframammary plane. So before going for the implantation of the silicone inside the breast, you have to first consult the doctor who is going to perform the surgery. First of all, your doctor will assess the current size of your breast, and he will ask or he will assess the amount of the volume which you requires. According to the volume which you require will be your implant size. Silicone implants are measured with the various parameters such as the diameter of the implant, the projection of the implant, the volume of the implants and its shape. There are the different shapes, different textures of the silicone implants are present in the market. It all depends on your condition, your choice, your present size, the amount of the pocket which can be easily created under the breast. These are the factors which basically decide the size of the implant. So now the surgery is done under the general anesthesia. The 4 to 5 centimeter incision is just giving under the inframammary crease, from which the plane is created, the subfacial plane is created, and the amount, the volume or the diameter of the implant that which approximate inside the cavity is cleared. So the pocket is created and the silicone implant is placed inside the breast. Now the incision which was made is closed into the multiple layers. Following the surgery, your dressing will be done by strapping the breast by the adhesive tapes. So most of the centers, these surgeries are done under the for daycare basis, and most of the centers, those who used to keep the patient for at least 24 hours or the 48 hours, as per the patient choice. In my center, I prefer to keep the patients at least for the 24 hours in the hospital for the better recovery and for the better weaning off from the general anesthesia. The patient, if the patient is the local patient in which the city in that city is living where the surgery is performed, she may discharge after the 24 hours either by the IV antibiotics or on the oral antibiotics as per the surgeon's choice. But most of the patients, those who came from the outside the city, should preferably be reside in the hospital at least for 48 hours and should be discharged after the first dressing with the support garments. Support garments are the very necessary after the breast augmentation surgery because this compression garment used to keep the implant in place. It helps to prevent the undue tensions on the sutures line. It helps to prevent the discomfort of the patient and give the feeling of support. Patients should consult the doctors after the 4 to 5 days or after 1 week, and after 10 to 15 days the sutures were removed if it was a removable suture. Following this, the patient should consult after 1 month or the 2 months just for the routine checkup. So these are the basic details of the breast augmentation surgery. Now we will be discussing in our next video with an example of a patient and its results. So stay tuned, please subscribe and click the bell icon for the more informative videos related to the breast augmentation. Thank you so much.